And just like that, we are at Mayo Clinic in Arizona for today's Heritage Highlight. We are on the beautiful nature trail here in Scottsdale, and I'm joined by Tyson Robinson, coordinator with Mayo Clinic Archives. How are you, Tyson?
I'm doing wonderful.
I should note that this is probably the hottest Heritage Highlight we've ever done. It's 9 o'clock on an August morning, and we're knocking on about 90 degrees. No big deal for you,
Nope.
Big deal for me. But Tyson, let's start talking about history and heritage here a little bit. How did Mayo Clinic arrive in Arizona in the 80s?
Well, we had quite a fun journey in the 80s when Mayo Clinic decided to expand outside of Rochester. They looked at several different areas and locations using a lot of different criterias. One of them being it needed to be far enough away from Rochester, that way it made sense to open a practice. The other was they drew a compass around sort of all the large cities to see where the population was, and they checked to see if there were clinic operations similar to Mayo Clinic, if it was a growing population, and if it was easy to travel, and then what type of impact Mayo Clinic could have. For Arizona, it was being considered along with Texas and California as possible locations of where they would like to come. And of course, they visited during our winter months.
Sure.
And so that really sort of sealed the deal.
So Arizona was chosen, Scottsdale initially, later Phoenix. There were also some challenges related to when you wanted to put up a building like this. Like this is the original building right behind us.
Absolutely. When Mayo Clinic decided to come to Arizona, they purchased this land, 139 acres, and we'll show you some pictures of what it looked like before, and there was nothing around. All the construction here has happened since Mayo Clinic has started here. So it was 139 acres, and it was zoned to be a single family housing. So Mayo Clinic had to fit within the designs of the zoning aspect. That zoning challenge came with how tall we could build buildings. Scottsdale has a rule then, it could only be 45 feet. Mayo Clinic's first proposed clinic was 60 feet. That was one of the changes Mayo Clinic had to make. You'll notice a lot of the buildings around in Arizona don't stand out so bright. We want to be one with nature. It's perfect being on the nature trail here. Right in with nature, sort of looks like it always should be there.
So Tyson, we talked a little bit about the building challenges. What about staffing?
Staffing was a lot of different challenges happened. In order to just get Mayo Clinic down here, we had to make sure that the licenses from our 46 physicians who came down, they could practice here in Arizona. And then the other challenges with opening up any type of building was in order to get quality individuals down here and also get people to help staff and make it is what it is today. And one of those great options were our volunteer services program that we have.
Speaking of volunteer services, I had a chance to sit down with Jackie Barr from Volunteer Services and a special guest. We'll talk to you in just a second, but let's check out that conversation. Jackie, thanks for joining us.
Thank you.
You are the manager of Volunteer Services here on the Scottsdale campus, and we also are joined by Sandy Pobanz, one of the volunteers. We'll talk to you in just a second. But Jackie, let's start with you. What some people may not realize is that Mayo Clinic Volunteer Services actually began right here in Arizona. Tell us about that.
Yeah, that's right. When we opened in 1987, we actually were inspired by the exceptional patient experience that was coming out of Rochester. So we thought, you know what, we want to bring that here to Arizona. So we established our Volunteer Services Department. We brought in people who were just very dedicated to the community and who really had that strong desire to also want to give our patients and visitors that overall positive healthcare experience.
And how did that start? It sounds like you had a very small group to begin with, right?
We started with only 5 volunteers, and they were actually spouses of Mayo Clinic employees who worked here. And I think we have a picture of this, but it was actually one desk and a chair just at the front entrance. And all they did was give directions and wayfinding. Over the years, we are now almost at 500 volunteers across our Arizona campus. So that includes Phoenix, Scottsdale, all our satellite locations, and volunteers are in several service assignments across all of those.
That's impressive. And talk about some of the programs from the earlier basic patient interactions to what it has become now.
We still have our basic fundamental programs where it's the wayfinding, pushing people in wheelchairs to their appointments, giving information on services that we have here at Mayo Clinic. We also put volunteers in clinical areas such as the emergency department, ambulatory infusion center, inpatient services, surgery waiting, and then we have some non-clinical areas where we put volunteers like the gift shop and the patient cafe.
And then one of the true highlights here, as well as at all the other campuses, I would assume, is your Caring Canines program, correct?
We have several specialized programs like our Caring Hands and our patient transport and our caregiver support program, but Caring Canines is our most popular. Everybody looks for it.
And that is why we invited Sandy to join us here. Again, thanks for taking a minute to chat with us, Sandy, and introduce us to our special guest here.
This is Will. He's 7 years old, and he's a white Labrador Retriever, and he's been a Caring Canine for 2 years. I've been in the program 12.
Just about the beginning of the program,
Almost,
right?
yeah, about 6 months after they started. It's so rewarding and fulfilling to give patients down to little children in radiation therapy. The staff stops me coming in. I can't hardly get to sign in because the staff is all stopping me.
And it sounds like it's a very rewarding experience for you personally.
Extremely rewarding. The first time I checked in and scanned in my badge to go in the secure area with my dog, I thought I had finally succeeded in life. I just love it.
Sandy, thanks so much for sharing these reflections. And Jackie, it sounds like with dedicated people like Sandy, your program is good to go for years to come.
Oh, for sure. We would never be able to provide this overall patient experience to our patients and visitors here in Arizona if it wasn't for the support of volunteers and these wonderful people that want to give back.
Wonderful. Thanks again to both of you for joining us. And Will.
Thank you.
Thank you.
Back with Tyson now. Tyson, we talked about raising a new building here, bringing in the staff, but how about that quintessential Mayo Clinic culture that is at the heart of everything here? How did you start that here?
That was all important coming. Can Mayo Clinic survive out of Rochester in Florida or Arizona? It was really a large concern from the staff and the leaders. Can Mayo Clinic travel to Arizona? Now, I think we've shown that it has traveled, but there was a lot of challenges in the way that we are able to present who we are in Arizona and who we are as Mayo Clinic. So we are lucky to have a lot of wonderful exhibits around campus. We have a great heritage hall, which is similar to Rochester's one. That is something we try to sprinkle around Mayo Clinic. And ways that we do that is through displays and exhibits and quotes, and you hardly walk down a hallway without seeing some reminder that you are at Mayo Clinic. We're really proud about the aspect of bringing the history from Rochester and making it meaningful for staff today.
And another aspect to that is, of course, the vast art galleries and art displays, which I was very impressed when I saw those on our tour yesterday. And we wanted to take a moment and chat with Kit Kough, the program director from the Center for Humanities and Medicine, to talk more about the role of art here at Mayo Clinic in Arizona. Kit, thanks for joining me.
Glad to be with you.
Give us a brief overview of the very large area of things you oversee here.
Well, we're very busy in the Center for Humanities and Medicine. In addition to our extensive loaned artwork program, we have a twice-weekly concert series. We have bedside arts in 5 different disciplines. We do a lot of work with our schools in terms of curriculum and professional development. And we also do special events.
I mentioned to Tyson earlier, I got a great art tour yesterday. As a matter of fact, we're looking at one nice piece here. Can you tell us about that?
So this piece was part of our anniversary celebration for our 20th here in Arizona. It was designed by our own anesthesiologist and former medical director for the center, Dr. Renee Caswell, and also Denise Courier. And so they put together the full design and then worked with a group of staff participants to complete the quilt. And it's very detailed and includes a lot of things unique to Arizona and the work we do in humanities.
It sure is. So one of many, many pieces here in Scottsdale, but also in Phoenix. Kit, what is the role of art at Mayo Clinic?
So, especially for an organization that is dedicated in service to humanities, it's important that we engage with the human experience. So one way to do that is to include art on the walls, and in particular for us, it is the rotation of those exhibits that feature a wide variety of media, of styles, of content. And that works well for both patients and staff. Patients in terms of maybe they can't go in different places where they might like to be, but they can explore through the exhibits. And also they might be here for quite a while. So we change up the environment. And of course, that's great for our staff who work here every day. I am loving it because I know that there's always more work to do. So as we expand within the fields of arts and healthcare and medical and health humanities, as we grow with our colleagues, there's more to explore and there's lots to do in thinking about not only how we create meaningful spaces for our patients and staff, but also how we think about what healthcare is like for the future.
Wonderful. Thanks so much for sharing your reflections. I appreciate it.
Very happy to.
Back with Tyson now, here in Phoenix now at Mayo Clinic in Arizona, because Tyson, we wanted to highlight a couple more iconic exhibits right here. And one of them is right behind us, the famous Mayo Clinic ambulance. Tell us more about it.
It is. Well, some of you may have seen this ambulance up in Rochester. It was purchased by the Mayo brothers in 1905. Been in service for about 10 to 15 years, but this was really to transport patients from the Mayo Clinic practice downtown to St. Mary's and the other hospitals that Mayo Clinic served at the time. It's really a wonderful piece of history that we're able to have here in Arizona. Shows a great history of how the Mayo brothers served the community. This was used up until about World War I when motorized ambulances came into play.
Very good. And the other item we wanted to talk about, the other display, is right outside here behind us, the Mayo Clinic ancestor statue.
Absolutely. Right outside, right before you walk in the doors, is our ancestor statue. It was designed and created by Glenna Goodacre. She did a lot of great exhibits and statues throughout the world. What people don't know is this statue composes all three of the males. It's the only one at Mayo Clinic. So it has the father and both of his two sons representing all different areas at Mayo Clinic. We have patient care, research, and education. They utilized a lot of archival photos. They used molds of the brothers' hands to make sure the vein, the details, the herringbone on the W.W. Mayo's hat is exactly what he would have worn. So the statue is meant to be approachable for both patients and staff. We invite you to come take a look at it.
Fascinating. Now, Tyson, before we go, your background is actually in museum studies, right? What brings a guy like you to a healthcare institution?
That question a lot, and Mayo Clinic is really a wonderful organization because it brings a lot of people from different specialties together. And for me, I look at Mayo Clinic and it has everything a great museum has. It has a wonderful story, the Mayo Clinic story, patient care. It has great exhibits. It's got great people. So really, I look at it and come to every day inspired by the work and the story of Mayo Clinic. And so it's always wonderful to be able to share it with patients, staff, and anyone else who comes and visits.
Tyson, thanks so much for showing us around a little bit. Very impressive displays here in Arizona. If you're a staff member and you would like to learn more about Mayo Clinic history, not only here in Arizona, but elsewhere at Mayo, search for the Heritage Program intranet site, or you can always go on the World Wide Web and look up the Mayo Clinic History and Heritage website. Tyson, thanks again.
Thank you
for watching.